Hello there, welcome to my YouTube channel. My name is Nima, you can call me Dara. I'm a medical laboratory scientist, and if this is your first time watching my video, welcome to my channel, and please subscribe because you're going to be getting really premium health information that's going to help you make informed decisions when it comes to your health. Keep it locked. So in this particular video, I am so excited. You know why? Because I also have 5 other health professionals who are dedicated to their jobs and are also passionate about sharing health information. I have them here with me in this video. They're going to be dishing out medical advice, with me as well. So I'm going to be starting first with mine. So medical advice is going to be based on what I've noticed, while working at the hospital. We have lots of laboratory tests that are really vital for everyone to screen for. But in Nigeria, where people self-medicate a lot and they self-test, the commonest tests that people run, anybody will be able to tell you that, oh, malaria test and typhoid test, those 2 tests, they have suffered in the hands of Nigerians. But there are a lot of other tests that are not talked about enough. And the particular one I'm talking about in my video today is lipid profile. This is a test that basically meant to check your lipid level, that's cholesterol. A lot of people, when they hear cholesterol, they think, oh, it's really bad. You shouldn't be consuming cholesterol. Anything that's cholesterol, cancel, cross it out. No, we have good cholesterol and we also have bad cholesterol. The same way we have good fat, we have bad fat. If you're consuming too much junks, cheese, burgers, and all those things, know that what you're consuming contains saturated fat, which is really bad for you. When you're consuming things like fish, like avocado, plant-based food, you can be rest assured that the fats that you're getting from those kind of foods are unsaturated and are very healthy for your body. So when we're talking about lipids profile tests, you have to fast, before the test is conducted on you. And when you're running this test, the lipids that we are most concerned about is the LDL, that's the low density lipoprotein, which is the bad cholesterol. That is what you're most concerned about. So don't say, oh, I'm not fat, this test is not for me. Only people that are fat or overweight should be doing this test. No, you're wrong. You don't have to be fat in appearance for you to do this test, because fats that you consume from your food in form of triglycerides are stored in 2 different areas of your body. Can be stored under your skin, that's what forms the fat appearance that you see, and also in the internal organs, that's what we call the visceral fat. The ones that are stored under your skin, in the adipose tissue in your skin, is what we call the subcutaneous fat. So you don't have to be fat in appearance for you to do this test. But if you fall into the category I want to list now, know that you have to take this test very, very seriously. If you have a family history of high blood pressure, or you already have high blood pressure, or you have hypertension, you have diabetes, or you have family history of diabetes, if you take lots of junk food, if you take foods that have saturated fat, basically, know that you need to run this test. If you're also the type that lives sedentary lifestyle, you don't move about, you don't exercise enough, you should consider doing this test. Also, if you're growing older, let's say from 40 and above, you need to take it more importantly. But you can actually do this test once you're an adult. You don't have to clock 40 before you start doing it. But once you clock 40, know that it's something that you must start doing, regularly. Maybe like every 6 months, go take that test. A lot of times you hear, oh, this person slumped and died, this person had a cardiac arrest, and the person died on the spot. It's because sometimes they avoid doing the test, which is this fasting lipid profile test, that can help to measure their chance or their risk of having this sort of conditions. Go to an accredited hospital or laboratory to run this test.
Hi everyone, how are you doing today? My name is pharmacist Rashida Tadekule, and today I want to talk to you about something that can transform your life. That will transform your health. I want to talk to you about eating fruits and vegetables. Why is it important to eat fruits and vegetables? Fruits and vegetables are packed with vitamins, minerals, fibers, antioxidants, things that will help you live a better life, things that will help your body fight against infection and diseases, right? For example, vitamin C in oranges contains antioxidants that will fight against free radicals in your body for you. Potassium from banana and sweet potato will help regulate your blood pressure. Fibers from apple will help lower your cholesterol and control your blood sugar. And the thing is, you don't have to wait till you have these conditions before you eat fruit. And I'm sure you know that fruits are affordable. I'm sure you've seen videos of people waking up and taking supplements. While it is very good to take supplements, all of these vitamins and minerals that you're getting from supplements can be getting from fruits rather, and vegetables. And I'm sure you know that these are much more affordable ones. So this is nature's prescription to you. Why are you not taking fruit? And let's not forget the attractive colors of these things. We are seeing the greens, the red, the oranges on your plate. Why exactly have you not committed to it? It might be a burden. Research has shown that eating 5 servings of fruit a day can lower the risk of blood pressure by up to 20%. And that's just one apple here, few sticks of carrots there, everything all through the day. What is so difficult about that? I know if you've not started, it might be a big deal. So just commit to having at least 1 serving in a day and watch you start your health journey. Promise me that you're going to commit to your fruit journey starting from today. Ciao.
I'm Dr. Samson Matthew. Today I'll be discussing about hypertension. Hypertension is one of the causes of mortality and morbidity in our environment, especially to we the black race. It's usually asymptomatic most of the time. Patients usually present to the hospital when there are already complications and when little or nothing can be done. So hypertension simply means that there is elevated blood pressure and there are classification for hypertension. But most of the patients in the black environment do present at stage 2 of hypertension, and there is no known cause of hypertension to be precise, but there are risk factors, and risk factors include age. The elderly, they are at risk of having hypertension. That's those older than 65 years old. Our race as black predispose us to having hypertension. Then the incidence of obesity, our dietary intakes. Most of our food now contains processed fat and processed carbohydrates, which the body usually converts to fat and store in the body. This has also contributed to elevated blood pressure, which is also known as hypertension. Then also in our environment, the sedentary lifestyle, we don't exercise, we don't move about. All these things has predisposed us to having hypertension. So, as I have initially said, that most patients present when they are having complications, when they already have stroke, when they already have end-stage renal disease, when nothing can be done. And so, for our own best interest, it is very important for us to always go and check our blood pressure at least twice in a month in any clinic that is very close to us. If it is elevated, we'll be alerted and will be redirected to a nearby hospital where other investigation will be conducted and we are going to be commenced on medication. Also, let us make it as a practice that we reduce salt in our diet. We reduce processed food like noodles, like pastas, we reduce them, like butters, margarine in our meal, junks like egg roll, fish pie, meat pie, all those things, we have to cut them down because all this eventually increase the blood pressure and predispose us to having hypertension. Also, let us cut down our salt intakes. The spices that we use in our meal to cook our meal is also very important that we cut it down, as this also can predispose us to having hypertension. And let us remember, routine check is the major and most important test towards diagnosing hypertension. Once or twice in a month, let us just routinely go to that our clinic around us, to that pharmacies that are around us. They already have the machine for checking the blood pressure, that's the sphygmomanometer, and they will check. If it is elevated, they will inform and alert us, and we can go to nearby hospital for follow-up and further investigation. Thank you very much.
Hi, I am Dr. Sfelo Ojebode, registered nurse, and in my line of work, I've seen something many people overlook, and that's just how fragile life and health truly are. I've had a patient who was rushed into the emergency room after she went for a prayer meeting, and while checking her vitals, she slumped, yeah. And while checking her vitals, her blood pressure was 210 over 120 millimeter of mercury. And that's a full-blown hypertensive crisis, a step away from stroke. We see this often. People ignoring their symptoms, hoping for miracles, and leaving everything to chance. But the truth is, health is impermanent. Please do well to rest, eat well, monitor your blood pressure, and do that hospital visit. Do not ignore your signs. Take that hospital visit. Yes, you should check it up. Because from where I stand as a nurse, the best treatment you can give yourself is not in the emergency room. It's in the choices you make, and it starts with you. Thank you.
Hi everyone, this is Akinade Jonah, a diagnosis radiographer. Our work involves the use of machine, various form of equipment to examine the internal structure of the patient. And some of this equipment make use of ionizing radiation. We all know that ionizing radiation poses some health risk to the patient, like stochastic effect. Yeah. So in order to prevent this, we ensure that every procedure that involve ionizing radiation must be justified. However, we notice during my course of practicing, I noticed that some of our patients walk in and do this procedure without medical personnel consultation, without doctor consultation, which is actually bad. Please, I want you to know that the more you expose yourself to radiation, the more likelihood you can affect yourself. Okay, so please and please, any procedure that you are going for that involve ionizing radiation must be justified. We are doing this in order to prevent you from exposing yourself to unnecessary radiation, which can cause health issues. Probably not now, but in the future. Thank you very much. God bless you.
Hi, my name is Ahmed Amono Olabi, a medical laboratory scientist. Today I'll be sharing with you 9 tracks infection tips for female. What are the things you need to do? What are the things you need to avoid as a female? Things you need to do as a female include 1. Drinking of plenty water daily. This will flush out bacteria during urination. 2. Urinating after sex. 3. Wearing a cotton underwear. 4. Maintain a good personal hygiene. What are the things you need to avoid as a female? Things you need to avoid as a female include 1. Holding in urine for a long period. 2. Wearing a tight or damped underwear. 3. Avoid the use of feminine spray. 4. Excessive intake of glucose. So these are the tips that you need, and these are the tips that you need to avoid. So stay clean, stay dry, stay hydrated.
So guys, it is not a mistake that like 2 or 3 of us in this video are talking about high blood pressure, hypertension, diabetes, lipid level, and stuff like that. It's because cardiovascular diseases are real and they're the leading causes of death globally, worldwide, not just in Nigeria. So you see why you need to take it really importantly. Make sure that you live well, eat right, take the necessary medical screening that you need to do. If you don't have the money, you can save up to do it, because your health is your real wealth. Well, this is the end of my video. Don't forget to share my video. I'm very sure it's going to help a lot of people out there. Share with that person, that you love or you hate. I'm really going to appreciate it. Also, please subscribe to my channel. Thank you so much. See you in my next video. Bye.